Hi, in this video, we will learn how to assess breastfeeding. As we all know that breastfeeding is very essential for the survival of newborn. It will be better if we know whether the breastfeeding is going well or going bad. If the breastfeeding is not doing well, then you need to help the mother so that her breastfeeding is more successful. So that's why we have something called a latch score. So a latch score is a scoring system for assessing the breastfeeding. So latch is also otherwise known as attachment. And attachment or latch is the key to successful breastfeeding. So as we all know that in order to the baby to successfully attach, the mother needs to place the lower lip to the undersurface of the areola and the upper lip to the nipple, and so that the baby's mouth opens and she can insert the lower part of her areola so that the nipple enters the mouth of the baby deeply. So that is called a good attachment. And so in a good attachment, the mouth is wide open and most of the lower part of the areola is inside the baby's mouth. The lower lip is everted or pushed outwards and the chin is touching the breast of the mother. So why do we need this latch score? We need this because breastfeeding is very important and we need this to guide young mothers, especially mothers who are having baby for the first time in their breastfeeding journey. And this also helps to equip busy nursing and medical professionals to give accurate and systematic breastfeeding teaching. So in latch score, we assess 5 things. The first thing that we assess is the latch. And we give scores like 0, 1, and 2. Then after latch, we assess the audible swallowing. And after audible swallowing, we assess the type of the nipple. And after the type of nipple, we assess the comfort of the mother regarding her breast and nipple. And finally, how good the mother is able to hold the baby. So a latch score range from 0 to 10 with each of the 5 components scored from 0 to 2. And the interpretation is if the score is between 0 to 3, it is considered a poor score. If the score is between 4 to 7, it is a moderate score and there is room for improvement. And if the score is between 8 to 10, then it is a good score. So a score of below 8 is considered low or unsatisfactory. Now L for latch. A score of 2 is given if the baby grasps the breast adequately, with the tongue down and forward and lips flanged out and the mouth widely open, and if there is rhythmic suckling. A score of 1 is given if the baby grasps the breast after repeated attempts, and the nipple has to be held into the mouth of the baby, and the baby must be stimulated again and again to suck. A score of 0 is given if no latch is obtained despite multiple attempts, and the baby is too sleepy or reluctant to feed. And such babies need to be reported to the newborn doctor for assessment of any infection. Now, the second parameter we use is the audible swallowing assessment. A score of 2 is given if you can hear an audible swallowing, spontaneous, however intermittent, in a baby who is smaller than 1 day less than 24 hours old, and audible swallowing is heard spontaneous and frequently in a baby who is more than 1 day old, 24 hours old. A score of 1 is given if a few audible swallowing is heard with stimulation, and the score of 0 is given if no swallowing or no audible swallowing is heard. Then the third parameter we see is T for the mother's nipple type. Score of 2 is a good nipple with a everted shape after stimulation. The score of 1 is a mother with a flat nipple and despite stimulation. And a score of 0 is given if the mother is having a nipple which is inverted as shown in this picture. C, fourth parameter is C for comfort of breast and nipple. Score of 2 is given if the breast is soft, tender, and the nipple is intact with no damage. Score of 1 is given if the breast is fuller, there is filling and small blisters or bruises may be there. Mother complains of pinching or mild or moderate discomfort. And score of 0 is given if the breast is engorged with the milk which is not evacuated from the breast, and if the nipple is cracked or bleeding, or there is large blisters or bruises on the nipple, or if there is severe discomfort. Finally, H stands for assessment of hold of the baby. Score 2 is given if no assistance is needed from the staff and the mother is able to position and hold the infant. Score 1 is given if minimal assistance from the staff is needed, or if there is need for elevation of the head or place pillows, and minimal assistance in the form of teaching on one side and mother does on the other side, and the staff helps and the mother takes over for feeding. And score 0 is given if the staff is always needed for feeding. If the mother needs assistance throughout the feeding schedule or full assistance is needed, the staff holds the infant at the breast, then score 0 is given. So latch is not a one-time assessment. You need to reassess the feeding after say 1 day or maybe even every shift. If the mother is experienced and she may have higher score and no assistance may be needed. However, if the score is less than 7 or less than 8, due to any reason, assistance might become necessary. Initially, healthcare personnel assess the score. However, mother can report the score by assessing herself, and that can be also useful. And this can be done by the following questions. First is L for latch. How fast the baby is grasping the breast and within how many attempts? Second is A for audible swallowing. Is there audible swallowing and what is its frequency? Third is T, everted or flat nipple. Fourth is C for comfort of breast and nipple, whether there is severe discomfort for the breast or is it full but soft. And H for hold, whether she seeks the help of somebody to hold the baby. So what is the clinical implication? A score of less than 8 may be objectively monitored and remedial measures may be implemented. So that is the importance of Latch Score. Thank you for your patient listening.